Thanks so much for making our tails wag by watching this guest interview from Arden Moore's Four-Legged Life.
Pause up, pet pals. Welcome to Arden Moore's Four-Legged Life Show. I'm your host, Arden Moore. Pain can be a real pain, not only to us, but also to our dogs. So can stress and anxiety. Fortunately, our special guests today are the go-to experts on managing pain and alleviating stress to our four-leggers. First up, give pause and applause to a world-renowned veterinarian. She's dedicated her life's mission to manage and alleviate pain in our pets. She is the hospital director at Windsor Veterinary Center and founder of the Downing Center for Animal Pain Management in Windsor, Colorado. Oh, and yeah, she was named the Leo K. Bustad Companion Animal Veterinarian of the Year in 2020. Please welcome to our show, Dr. Robin Downing. I am so jazzed you're on our show, Dr. Robin.
Well, good morning, Arden, and thank you so much for inviting me. I'm just delighted to speak with you and to have a chance to talk about my very favorite topic, animal pain.
Yeah, well, I was going to say that pain is a four-letter word, and we're going to step back. We're going to be in a time capsule with you, okay? So pop in 30 years ago. You're a barely out of diapers veterinarian. See what I'm doing here? Making you younger than you are. And pain management wasn't really on the radar, would you say, in the world of managing pets? I mean, I remember when I was the editor at Catnip at Tufts University, there were some veterinarians that didn't think cats could feel pain. And I'm not that old, well, I am old. But let's go back. So 30 years ago, you learned a lot in veterinary medicine, but I don't think the topic of pain management was as pronounced as it is now.
What a great question. And I really feel like this historical context is really important. So when I love telling this story because it really illustrates what kind of transformation has happened in veterinary medicine. So in my second semester of my second year of veterinary school, I was in the lecture hall, and the head of surgery at the University of Illinois College of Veterinary Medicine came in to lecture to my class. And he actually told us in a lecture that we should not relieve all the pain from our postoperative patients because they would move around and hurt themselves. And even as a student, that just didn't make intuitive sense to me. But what did I know? I was just a veterinary student. And so in 1986, when I graduated, I moved to North Central Wyoming, and I actually founded up a house call practice. It was the first. It was the first companion animal-oriented practice in that part of the state. I was the first female practitioner in that part of the state. I was the only female practitioner for 100 miles in any direction.
Yeehaw!
And I served 10 communities, and I drove 3,200 miles a month, bringing quality companion animal care into people's homes. And I did some equine medicine, and I did a little bit of cattle and goats and sheep, but my primary focus was companion animals. And I had 2 years into my practice, a little red heeler who came to me with a bowel obstruction. And she was so miserable. And I knew that she would die from her pain if we did not deal with that. So I was very fortunate that I had a human general surgeon as a client, and I called him on the phone. It was like, who wants to be a millionaire calling your lifeline?
Yeah.
And so I asked Vern if he would talk to me. And to his credit, he never once said, what kind of a doctor are you? How come you don't know this? But he did start out by saying, have you never heard of morphine? And it went from there. But the bottom line was that I initiated some very aggressive pain management that I really hadn't been well taught in school. And that little girl survived. She's
in doggy heaven going, there's Dr. Robin on the show talking about me.
So there's that dog, her sibling, 2 brothers, and 25,000 sheep. And she was back at work in 10 days.
I was going to
So
say no sheep, but sheep. It's radio.
25,000 sheep. It was
Wow.
amazing.
Wow.
And so she really changed my paradigm. She changed my practice, and she actually changed the trajectory of my career.
Isn't that amazing? Because we think we're going to script our career. We're going to get married at X years. We're going to do this at this time. La, 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 la. Life has another plan. And I think flexibility, adaptability, and maybe paying attention to the signs. That's why you are who you are, Dr. Robin Downing.
So fast forward.
Yeah.
In 1991, I bought the Windsor Veterinary Clinic, and it was in the 90s that I really became an activist in this area of pain management. And it was all around the time that Pfizer Animal Health introduced carprofen, brand name Rimadyl, into the market as the very first non-steroidal anti-inflammatory drug for dogs in our world here in the United States in veterinary medicine. And it was really all of that, understanding that 20% of dogs and cats across all ages suffer from the pain associated with osteoarthritis. What an eye-opening statistic that was. And when I think about from the mid-90s until now, how pain management has evolved and our understanding of the fact that we need to look for it so we can find it.
Right.
And then when we manage it, we can't manage it with a single tool. We have to use multiple tools that address that pain from different perspectives. That's called multimodal pain management. And we now know that that really needs to be our fundamental approach. And so pet owners, dog owners, need to not be freaked out when they hear the veterinarians say, we need to do A, B, C, and D in order to help your dog or your cat who is experiencing pain. They need to not perceive that as, well, I'm going to be over-medicating my dog. No, 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 far from it. We know that pain is a very complex process, and we have to put that pain patient at the center of the caregiving circle. And each one of our tools is like the spokes on that wheel that helps that pet really achieve its highest level of comfort, and more importantly, its best level of function. And then finally, it adds years to their lives and life to their years.
Well, I know pain is a 4-letter word that we think of other things that also have 4 letters in it. How would you best define pain in a dog?
So it's very interesting to think about the physiology of pain, which is the nervous system piece. So we have an adverse input from an area of the body that's painful. So we have this afferent going to the spinal cord, barrage of signals. That's the physiology of pain. But then we have the suffering dimension of pain, and that's where the ethics of pain management come in, not just the physiology of pain management. So we have an ethical imperative to understand that animals have an emotional response to these adverse signals, and it alters their mentation, it alters their emotion, and it alters all of their functions of life. And we think about it's deceiving to think about pain as just a physiologic experience.
I like that.
We really need to broaden our perspective and understand that it has an emotional dimension. That's the suffering aspect, but it also has an intellectual component. And where that becomes important, Arden, is understanding that dogs learn that when humans touch them, it hurts. And we can end up with a dog who, and I know that Dr. Prim is going to talk about this, will escalate into fear, anxiety, and stress that can translate to aggression just because they know if a human touches them, they will hurt. And so they're going to bite first and ask questions later. I have to tell you about...
Well, hang on a second, because we do have to take a quick commercial break.
Oh, my gosh.
I know, it goes by fast. Hey, everybody, we're speaking with Dr. Robin Downing, and she is painlessly talking to us about pain. We're going to be right back after this break. Sit and stay. Welcome back to Arden Moore's Four-Legged Life Show. We're here with Dr. Robin Downing, and we're diving deep into pain. So I'm laughing because she said, what is it? What was your saying about bark, bite more, bark less? I'm laughing because I'm actually drinking coffee today from a mug that says wag more, bark less. So I'm the opposite of the pain spectrum, but please continue.
Okay. Let me tell you a quick anecdote about a dog. Bite first, ask questions later.
That's it.
I'm painful. I know that humans touching me hurt. I don't want humans touching me. Ergo, I will bite first, ask questions later. I met a dog named Diesel. Diesel came to me with extensive skin infection, skin disease. He's a Mastiff mix. He had these skin folds that were infected, and he had osteoarthritis, both elbows, both hips, both knees, and profound back pain. And all over his medical record, he's a bad actor. He needs to be muzzled. His owners were like, he's a bad actor. He needs to be muzzled. He's never liked the veterinarian. So first thing we did was understand that he was escalating into fear, anxiety, and stress. And so we aborted his first visit. We provided him with a pre-visit pharmaceutical to help him not escalate, to stay in the thinking part of his brain.
Yeah.
I was able to assess him, understand how painful he was, understand that he had some metabolic conditions that had never been addressed. Within 4 weeks, he was a dog transformed. And what made me sad is that when I met with them 4 weeks later, and they could see the dramatic change, he wasn't where he needed to be, but dramatic change, they wept in the exam room. They said, how did we miss this? How did we not know that for 7 years our dog was suffering?
Oh my gosh, Diesel.
And this is where we as veterinarians, we have a special obligation to really look for pain and discomfort so that we can help partner with our clients, partner with dog owners who love their dogs. They're a beloved animal family member, to help those dogs be the best that they can be. And that actually gives me a chance to ask if we can talk about cats.
Yeah, we're going to talk about cats. You said cats?
Cats?
Oh, yeah. Well, hang on. Brad, we're going to do cats right after this segment because we're going to put you on two shows.
Okay.
So, but here, Brad, don't worry. We're going to transition this way, which, hey, Dr. Robin, it brings me to ask you to talk about what you call the 3 R's: recheck, reassess, and revise. Hey, I did my homework on you.
Yes, you did. So one of the things that we know about pain is that it's not one thing. We know that we can't treat it with one treatment, monotherapy. We have to use multimodal therapy. The other thing, though, that we have to understand is that most of our patients who have pain over a longer period, so I'm not talking about the dog that comes in to be
chronic
neutered.
And acute, right?
Right, exactly. So the dog that comes in to be neutered, they're going to have a painful period right after surgery. We have ways to address that, and then it's done, bada bing, bada boom. But the chronic
Wait a minute, I like this. This very scholarly veterinarian just went Tony Soprano here.
Exactly. But chronically painful patients, they are a shifting landscape. And what that means is that we and our dog owners have to be in partnership to understand that that dog is going to change over time. And what that means is that we need to recheck that pet on a regular basis because their pain experience will change over time and our need for medication and our dosing for medications will change. So when I talk about recheck, reassess, and revise, what I mean is when that dog is there in front of me, we make a plan and then we're going to work that plan. But we have to understand if the plan is working. So before that patient leaves my office, that dog's owner is making that next appointment for that reassessment. And at the reassessment, that's the time for us to revise our treatment if we need to. Sometimes what we're doing is decreasing our use of one medication. We might be increasing our use of a different medication. It may be time for us to initiate physical therapy, for instance. It may be time for us to initiate some home therapy. I assign a lot of therapeutic exercise for people to do at home because so much of really what makes a difference is what happens at home
Yeah.
in between those visits when we do our recheck, our reassessment, and we revise the
So
treatment.
let's our pet parents help our pets and veterinarians like you. We've got a couple minutes left. What are some things that they should be looking for, being like a pet detective, looking, listening, smelling, safely touching, that could be passed on to you and other veterinarians to really zone in on that pain management?
So the most important thing that I try to communicate with our clients that they need to be vigilant about are any changes in the dog's behavior. Behavior changes
Okay.
are critical. So the dog has certain routine, they do certain things at certain times. We see changes. So for instance, some of the cues that I listen for will be things like, my dog used to eat really robustly and now he's a little bit off his game. Like sometimes he'll miss a meal. My dog used to run up the stairs to beat me to the bedroom. And now I have to actually remind him that we're going to bed. My dog used to love to ride in a car, and now he's not so happy about getting in the vehicle. We used to walk 3 miles, and now we get about a mile, and he's really lagging behind.
Okay.
It'd be really
These are good
simple
clues.
things.
Yes.
Exactly.
Yes.
So people think that my dog is painful, he's going to cry out. That rarely happens. People think if my dog is painful, he's going to limp. If I don't see him limping, he's not painful. That's not true. And another clue that is often overlooked is when a dog begins to object to being touched in certain parts of its body. My dog used to enjoy my brushing him. He doesn't like that anymore. I think he's just getting old. That is not true.
Okay,
that is
I love
just
this.
not true.
Hey,
simple thing.
we're speaking with Dr. Robin Downing. I wish I could talk to her 24/7 because my brain is all my nerve synapses are yay, celebrate. We can find out more about the work of Dr. Robin Downing by going to downingcenter.com. Is there any other place you want to steer our listeners to?
I do. The International Veterinary Academy of Pain Management, IVAPM. The International Veterinary Academy of Pain Management does have some pet owner facing materials
Excellent.
that can really help pet owners, dog owners and cat owners better understand some of the issues around pain and pain management, and help pet owners find practitioners who are engaged and involved with the IVAPM. IVAPM.org.
Excellent. Hey, everybody, stick around. We're going to take a quick break. And when we come back, we're going to speak to Dr. Kat Prim. Her name is Kat, K-A-T, and I'm not kidding. And she's going to get into a little bit about fear-free and how to deal with stress and anxiety. So sit and stay. We'll be right back.
Thanks so much for making our tails wag by watching this guest interview from Arden Moore's Four-Legged Life.
Four-Legged Life.
Make sure to subscribe so you're up to date with all of our Four-Legged Life content.
Four-Legged Life. Four-Legged Life.